Had a meeting there yesterday at the Youth Center, and we had about 50 or 60 people attended, all workers for the Band Council. We invited Innu Nation, we invited Group Home, we invited Innu Roundtable, all the agencies, the school officials, we invited it. And we invited Grenfell Labrador, Grenfell Health, Heather Brown, who was talking on behalf of the health board, and later on Dr. Maureen Bakey joined us by phone, and she did explain what needs to be explained, and she would join us by phone. And people in the audience had some questions for her at the end of her presentation, so that took the whole morning.
And we discussed about the virus going on in the world, and well, it's just to be precautionary measures in our communities. Both communities, Sheshatshiu and Natwashish, and show us and tell us how to avoid about that virus, how to clean your hands and how to cover your mouth when you're coughing or when you sneeze, and try to avoid as much as gatherings as much as you can. And
one of the things that we were being told that we should try to avoid in doing large gatherings, because that's one of the areas that we should avoid doing that again. So we've been asked maybe we should use as much as social media, go on the radio for if we need to communicate with the community. So
need to be precaution and try to avoid that virus as much as we can. And like the way they tell us, the health authorities, that we need to clean and wash our hands and try to avoid as much as the gathering events happening. There's supposed to be an emergency planning committee formed, hopefully sometime early next week, and then all the organizations will participate on that committee, and we're going to try to update as much as we can.
What are we going to do next time? We're going to try to get some nurses or some health officials to come down and do a demonstration how to look after yourself, like how to wash your hands properly, don't rub your eyes or don't touch your mouth or your nose and whatever, and make sure you cover it when you're coughing and whatever. So those are based on the things we were told to share. Maybe when more the doctors or the nurses are doing the same thing as we're doing, then they'll probably explain more, and they're willing to come down here and do a radio show and do a talk show and take answers from the public. So we're looking for that. Once we get more details and what the plans are as we go, we will definitely let you guys know what we're doing.